Hello friends, this video on reproductive health part 5 is brought to you by examfear.com. No more fear from exam. So we will start with the natural contraceptive methods. Now as the name says natural, so it happens by itself. It is nothing artificial. It happens on its own. So let us see what are these natural methods. So some of the natural methods are, so the first one is coitus interruptus. So what is coitus? Coitus is nothing but this is another term for sexual intercourse. So coitus interruptus. Interruptus means something which interrupts. So interrupted intercourse, that means withdrawal of penis just before ejaculation. So during the intercourse, the penis is inserted inside the vagina, right? Now, before the sperms get ejaculated from the penis into the vagina, just before the ejaculation, the penis is withdrawn, which is taken out, so that the ejaculation happens outside the vagina. That means the sperm will not enter inside the vagina. So if sperm has not entered, so there can be no fusion, so there can be no fertilization, so there can be no pregnancy. But in this case, it all depends upon the willpower of the male partner. So insemination is avoided. Insemination means putting the seminal fluid inside the female reproductive tract. That is called insemination. So that part is basically avoided because the penis is taken out before the ejaculation of the sperm. So that is coitus interruptus. So this is a natural method where you don't use any external device, you don't use any medication, nothing. But then again, the disadvantage is that it depends upon the willpower. Next is periodic abstinence. Periodic abstinence. What does it mean? It means to avoid having sexual intercourse during the fertile period. Now, a very good question here is, how do we know which is the fertile period? So in our last lesson, we saw that fusion can happen only after ovulation, because ovulation is the process where egg is released into the fallopian tube, right? That is what we studied in our last lesson. So now, only after the egg is released, only then the fusion between egg and sperm can take place. Correct? So, ovulation occurs around 14th day of your menstrual cycle. So, your menstrual cycle, from where does your menstrual cycle start? Menstrual cycle starts from the day 1 of your menstrual flow. So, let us suppose if your menstrual flow started from, let us suppose, say, 4th of January. So, that means 4th of January is the first day of your menstrual cycle. So, the ovulation happens somewhere around the mid of the cycle. So maybe somewhere around, say, 15th, 16th, 17th. So somewhere during that time, ovulation will happen. So it is very obvious that the fertile period, that means the period when you are more prone to get pregnant. So that is the period where there is more possibility of fertilization taking place. So for that you need the egg. So the egg gets released in the mid of the cycle. So immediately after ovulation is the fertile period. So that means we can say that, if we consider that 4th January was the first day of menstrual cycle, if we assume that. So somewhere around the 14th day would be your ovulation. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So 17th January is 14th and 17th January is approximately your date of ovulation. Now again, ovulation doesn't happen exactly on the 14th day. It might happen on the 13th, it might happen on the 15th. So you have to consider that plus minus on both sides. So if we suppose it is around 17th of January, right? So that means after this is going to be your fertile period, right? So that ways, which is the fertile period? So that ways the fertile period is going to be the 10th day to the 17th day of the menstrual cycle. So here in this case, if this is your first day, this is the first day of menstrual cycle, then what is this? This is going to be your 14th day. Now we are taking few days before and few days after. So maybe if this is your 10th, then 10th to somewhere 17th, 18th. So that is going to be your fertile period. because your ovulation is not going to happen exactly on 17th of January. It might happen a little before, it might happen a little after. Right? So please remember that when I say 10th to 17th, what I mean is 10th day of the menstrual cycle, again 17th day of the menstrual cycle. So some couples, what they do is they avoid having sexual intercourse during this time, because during this time is the maximum possibility of fertilization. So they avoid having sexual intercourse during this time. So fertile period includes the days just before and after ovulation. Now why it includes days even before ovulation? Because if you have an intercourse immediately before ovulation, the sperms will still remain inside your vaginal tract or inside your reproductive tract, right? Because the sperms remain alive for 6 to 7 days. But what happens to the egg? Immediately after ovulation, the egg remains alive only for 24 hours. So even if somebody had an intercourse, say 1 day before ovulation, so the sperms are still there alive. So there is a possibility that there might be fusion between the sperm and the egg which has been released that time. So that ways the intercourse immediately before and immediately after will help in fertilization or can make you pregnant. The third method is lactational amenorrhea. Now, what is lactational amenorrhea? Lactation is nothing but the lactation period when a female is breastfeeding a newly born baby. So that is called lactation period. So lactational amenorrhea. What is the meaning of amenorrhea? A means without. Without what? Menorrhea. So here menorrhea is derived from the word menstruation. So that is why it is meno. So without menstruation. So that means when a female is in the lactation period, when she is breastfeeding a small baby, that time she doesn't have the menstruation process doesn't take place. So this situation is called amenorrhea. So absence of menstruation in the lactation period. So now when your menstruation itself is not happening, that means inside your body ovulation also is not taking place. So as a result, this is going to be a safe period. So even if you have sexual intercourse, there is going to be no egg inside. So there will be no fusion and no pregnancy. But there is a disadvantage of this method. Now this lactation amenorrhea or this absence of menstruation lasts for a maximum of 6 months after the baby is delivered. This will last, that means this will act as a contraceptive method only for those 6 months. After that again the female will come back to her normal processes, and as a result this will not act as a contraceptive method. So this is going to be effective as long as the mother fully breastfeeds the baby. So that time the chances of conception is almost nil. But this method is going to be effective only up to 6 months. So therefore we can say that the chances of failure of this method is quite high, because this 6 months again is not fixed. For some female it might be 6 months, for some female it might be 5 months. So you never know. However, in all of these methods, there are no side effects as such, all the natural methods, because you are not actually using anything external. So your body is not exposed to anything external. It is just that they all depend on your willpower. So whether you are able to have your sexual intercourse only during the time you want, or you are able to control yourself during the fertile period, or you are able to control your willpower for withdrawing the penis. So everything depends on your willpower, but there are no side effects. So this was about the natural methods. So if you look at their advantages and disadvantages, the advantage is that they do not have any side effects, no side effects at all. The disadvantages is that there are high risks of failure, because for example in lactational amenorrhea, you never know when the menstruation will start back again. So you are not very sure for how long it will be a contraceptive method. Similarly for the other two also, it all depends on your willpower. So the risks of failure are quite high. Thank you. Please visit www.examfear.com to watch more videos, attempt free online test, get free study material, find tutors and mentors. Thank you once again.